Hello future nurses, welcome to another NCLEX practice test video, where we tackle the most frequently asked NCLEX questions, the ones that have appeared more than 5 times in the last 5 years. These are the high-yield, must-know questions that can make a difference in your exam. So, stay focused, take notes, and let's get started. Question 1. A nurse in the emergency department is evaluating a pregnant client at 37 weeks gestation who presents with intense abdominal pain and significant vaginal bleeding. Which nursing action should be avoided at this time? Correct answer. Conducting a vaginal exam. Performing a vaginal examination in a client with active vaginal bleeding, especially in the late stages of pregnancy, is generally contraindicated unless in a fully equipped labor and delivery unit. Vaginal exams in such scenarios could potentially exacerbate the condition or cause further complications, such as worsening placental abruption or provoking additional bleeding. Question 2. A nurse is advising a client with advanced kidney disease on appropriate dietary choices. Which of the following foods should the nurse suggest as suitable for this client? Correct answer. Applesauce. Applesauce is recommended for individuals with end-stage renal disease, ESRD, as it is low in potassium, making it a safe option for managing electrolyte levels. Question 3. A pregnant client at 31 weeks presents at the clinic with complaints of facial swelling in her hands, and a severe headache. What should be the nurse's initial action? Correct answer. Take the client's blood pressure and other vital signs. The symptoms of facial swelling, hand swelling, and a severe headache are indicative of potential preeclampsia, a serious pregnancy complication characterized by high blood pressure and signs of damage to other organ systems. The nurse's priority should be to assess the client's blood pressure and vital signs to determine the severity of the condition and decide on the next steps for intervention. Question 4. The nurse is developing a care plan for a client recovering from hip surgery who needs to regain the strength required to climb stairs to reach their bedroom. Which referral should the nurse prioritize? Correct answer. Physical therapy. Physical therapy should be prioritized for a client recovering from hip surgery, particularly when the goal is to regain strength for specific functional activities like climbing stairs. Physical therapists specialize in rehabilitation, focused on improving mobility, strength, and overall physical function. Question 5A nurse is monitoring several clients who are currently taking lithium. Which client would be at the greatest risk of developing lithium toxicity? A client with chronic headaches starting naproxen. NSAIDs like naproxen can significantly increase the risk of lithium toxicity. NSAIDs reduce renal blood flow, leading to decreased clearance of lithium, which can cause an elevation in serum lithium levels to toxic levels. Question 6. A child at a school clinic is angry and accuses their teacher of failing them on a test, despite admitting that they did not study. What psychological defense mechanism is the child displaying? Correct answer. Projection. The child is exhibiting projection, a defense mechanism where individuals attribute their own unacceptable thoughts, feelings, or shortcomings to others. In this case, the child is blaming the teacher for their failure on the test, even though the failure was due to their lack of preparation. Question 7. A nursing student is studying the dynamics of abusive relationships and questions why victims of domestic violence often remain with their abusers. Which model provides an explanation for the recurring and escalating nature of domestic abuse? Correct answer. The cycle of abuse. The cycle of abuse, first described by Lenore Walker in 1979, outlines 3 phases: the tension-building phase, the acute battering incident, and the honeymoon phase. This cycle repeats and often escalates in severity over time, trapping the victim in an abusive relationship. Question 8. A parent is learning about immunization schedules for their infant. Which vaccine should the nurse inform the parent is typically administered before the child reaches 8 months of age? Haemophilus influenzae type B (Hib). The Haemophilus influenzae type B Hib vaccine is routinely given to infants starting at 2 months of age, with the series completed by 12 to 15 months. Administering it before 8 months ensures the child develops immunity during a vulnerable period. Question: 9A nurse is assessing a newborn who has yet to pass their first stool within the first 24 hours of life. What is the name of the initial stool typically passed by newborns? Correct answer: meconium. Meconium is the first stool passed by a newborn, typically within the first 24 hours after birth. This dark green sticky substance consists of materials ingested during fetal life, including amniotic fluid, mucus, and cells. Delayed passage of meconium could indicate intestinal obstruction or congenital conditions such as Hirschsprung's disease. Question. 10. During a routine assessment, a nurse observes that a client who has been categorized as having no special skincare needs has developed reddened areas over several bony prominences. What should the nurse do next? Correct answer: conduct and record a focused assessment of the client's skin condition. The nurse should immediately perform and document a focused assessment of the client's skin integrity, as the appearance of reddened areas over bony prominences could indicate the early stages of pressure injuries. Early intervention is crucial to prevent the progression to more severe ulcers. Question 11. A patient newly diagnosed with bipolar disorder is being assessed for appropriate medication management. Which drug should the nurse anticipate will be prescribed to manage this condition? Correct answer: lamotrigine. Lamotrigine is a key medication used as a mood stabilizer in the treatment of bipolar disorder, particularly effective in preventing the occurrence of both manic and depressive episodes. Question 12. A nurse is monitoring a client with diabetic ketoacidosis, DKA, who is receiving an infusion of regular insulin. Which laboratory value should be reported to the healthcare provider immediately? Correct answer: potassium level of 3.2 milliequivalents per litre. Potassium is a critical electrolyte that must be closely monitored in patients being treated for DKA, particularly during insulin therapy, as insulin shifts potassium into cells, potentially causing dangerous hypokalemia. Question 13. During the assessment of a pregnant client in active labour, the nurse notices that the fetal heart rate temporarily rises above the baseline and then returns to normal after about 15 seconds. What should be the nurse's immediate action? Correct answer: document the finding and continue monitoring. A transient increase in the fetal heart rate, known as an acceleration, is a positive indicator of fetal well-being and requires no intervention. Question 14. During a physical examination, the nurse percusses various areas of a client's abdomen. Which organ is expected to produce a tympanic sound upon percussion? Correct answer: stomach. Tympany is a high-pitched, drum-like sound typically heard over air-filled structures such as the stomach and intestines. Question 15. A client presents to the emergency department with altered mental status, slurred speech, pinpoint pupils, and decreased respiratory rate. Which condition is the nurse most concerned about? Correct answer: opioid intoxication. The clinical presentation of pinpoint pupils, bradypnea, slow breathing, slurred speech, and altered mental status strongly suggests opioid intoxication, which requires immediate intervention. Question 16. A nurse is preparing the care plan for an adolescent who is scheduled for spinal fusion surgery and will be hospitalized for several days. What is the best action the nurse can take to address the client's psychosocial needs? Correct answer: arrange visits from the client's friends. Adolescents highly value peer relationships, and facilitating social interaction can support emotional well-being during hospitalization. Question 17. After administering a bolus of IV fluids to an infant, the nurse weighs the infant's wet diaper and notes it weighs 40 grams. How many milliliters of urine should the nurse document? Correct answer: Kirk milliliter. In neonatal and pediatric care, 1 gram of diaper weight equals 1 milliliter of urine, making 40 grams equivalent to 40 milliliters of urine output. Question 18. A nurse is preparing to insert an indwelling urinary catheter and is considering which tasks to delegate to unlicensed assistive personnel, UAP. Which task can be safely delegated to the UAP? Correct answer. Place the catheter kit near the bedside. Placing the catheter kit at the bedside is a non-clinical task that does not require clinical judgment or sterile technique, making it appropriate for delegation to a UAP. Question 19. A patient with type 1 diabetes presents to the emergency department with signs of diabetic ketoacidosis, DKA. Which of the following assessment findings requires the nurse's immediate attention? Correct answer. Heart rate of 128 beats per minute. A heart rate of 128 beats per minute indicates tachycardia, which can be an early sign of hypovolemic shock in a patient with DKA requiring immediate intervention. Question 20. During a follow-up visit, a client on fluoxetine makes the following statement. Which statement should cause the nurse the most concern? Correct answer. I just don't see any point in living. This statement suggests suicidal ideation, which is a medical emergency requiring immediate assessment and intervention. Question 21. A nurse is assessing a victim involved in a hazardous chemical incident at a local factory. The client is alert but unable to walk and presents with a respiratory rate of 28 breaths per minute and a capillary refill time of less than 2 seconds. What priority level should the nurse assign to this client? Correct. Answer, delayed, yellow tag. The client is stable but not ambulatory, warranting prompt but not immediate care. Yellow-tagged patients have significant injuries but can safely wait for treatment. Question 22. A newborn, born 10 hours ago, is observed by the nurse to be extremely irritable, exhibiting a high-pitched cry and experiencing tremors. Which condition should the nurse suspect in the newborn? Correct answer. Neonatal abstinence syndrome. The newborn's symptoms of extreme irritability, a high-pitched cry, and tremors strongly suggest neonatal abstinence syndrome, NAS, which occurs when a newborn withdraws from substances the mother used during pregnancy. This syndrome is most commonly seen in infants exposed to opioids in utero. The constellation of symptoms, including jitteriness and a shrill cry within the first 24 hours of life, is indicative of drug dependence, requiring specialized care and monitoring. Question 23. A healthcare provider prescribes an infusion of 150 milliliters of normal saline to be administered over a period of 60 minutes. What should be the infusion rate in milliliters per hour? Correct answer. 150 milliliters per hour. The calculation of the infusion rate is as follows. To convert the total infusion time from minutes to hours, divide 60 minutes by 60 minutes per hour. This equals 1 hour. Next, determine the infusion rate by dividing the total volume by the total time. 150 milliliters divided by 1 hour equals 150 milliliters per hour. This means the infusion pump should be set to deliver 150 milliliters of saline per hour, ensuring the entire volume is infused within the prescribed 60 minutes. Question 24. A nurse is reviewing the medications prescribed to several clients. Which of the following medication prescriptions should the nurse critically evaluate? Correct answer. Hydrochlorothiazide for a client with hyperparathyroidism. The prescription of hydrochlorothiazide for a client with hyperparathyroidism warrants critical evaluation. Hydrochlorothiazide is known to increase calcium retention by the kidneys, which would exacerbate hypercalcemia in clients with hyperparathyroidism. This could lead to serious complications such as nephrocalcinosis or bone demineralization. Proper management of hyperparathyroidism often involves hydration with saline and using a loop diuretic like furosemide, which promotes calcium excretion rather than a thiazide diuretic. Question 25. During a staff education session on total parenteral nutrition, TPN, the nurse discusses various conditions that may warrant its use. Which condition justifies the use of TPN? Correct answer. Severe pancreatitis. Total parenteral nutrition, TPN, is indicated for clients with severe pancreatitis because oral or enteral nutrition can exacerbate the inflammation and pain associated with the condition. Pancreatitis often results in the inability to tolerate food due to severe abdominal pain, nausea, and vomiting. TPN provides the necessary nutrients intravenously, bypassing the gastrointestinal tract, which helps in managing the symptoms and promoting recovery without stimulating the pancreas. Question 26. The nurse aims to understand the diverse cultural beliefs of a patient during assessment. What is the primary reason for this understanding? Correct answer. Prevent assumptions about the patient's needs. Understanding the cultural beliefs of a patient primarily aims to prevent making assumptions about their needs based on cultural stereotypes. Every patient is unique, and their personal beliefs and practices may not align with general cultural norms. By recognizing these individual differences, the nurse can deliver personalized care that respects the patient's cultural background, ensuring that care decisions are not based on incorrect assumptions. Question 27. After a cervical spine surgery, the nurse is monitoring the patient's recovery. Which of the following symptoms should the nurse prioritize for immediate evaluation? Correct answer. Difficulty swallowing fluids. Difficulty swallowing fluids after cervical spine surgery is a potentially serious complication that requires immediate evaluation. It could indicate nerve damage or swelling in the cervical area that is impacting the patient's ability to swallow, increasing the risk of aspiration and other complications. Immediate intervention is necessary to assess and address any potential threats to the patient's airway and neurological status. Question 28. A nurse is preparing educational material on Cushing's disease for a medical seminar. Which of the following statements accurately describes Cushing's disease? Correct answer. Increased production of adrenocorticotropin hormone, ACTH. Cushing's disease results from the overproduction of adrenocorticotropin hormone, ACTH, by the pituitary gland, typically due to a benign pituitary tumor, adenoma. This excessive ACTH stimulates the adrenal glands to secrete high levels of cortisol, leading to the characteristic symptoms of Cushing's disease, such as central obesity, muscle weakness, hypertension, and characteristic facial features like a moon face and buffalo hump. Question 29. A nurse is analyzing a client's arterial blood gas results, also known as ABG. The values are pH, 7.31, PaSO, 2, 52 millimeters of mercury, bicarbonate or HCO3, 25 milliequivalents per liter. What do these results indicate? The correct answer is respiratory acidosis. Let's break it down. The pH is 7.31, which is below the normal range of 7.35 to 7.45. A low pH means acidosis is present. The PaCO2 is 52, which is higher than the normal range of 35 to 45 millimeters of mercury. This means carbon dioxide is being retained, causing the acidosis. The bicarbonate level, or HCO3, is 25, which is within the normal range of 22 to 26 milliequivalents per liter. This tells us the acidosis is not metabolic, but rather respiratory in origin. So, what is happening? Respiratory acidosis occurs when the lungs fail to remove enough carbon dioxide. This leads to CO2 buildup, causing the blood to become more acidic and lowering the pH. Common causes of respiratory acidosis include respiratory depression, such as from opioids or brainstem injuries, chronic lung diseases like COPD or asthma, neuromuscular disorders such as myasthenia gravis or Guillain-Barré syndrome, airway obstruction. Key takeaway: a low pH plus a high PaCO2 equals respiratory acidosis, caused by impaired breathing and CO2 retention. Question 30. A client receiving prescribed cilostazol is being monitored by the nurse. Which of the following outcomes would indicate that the medication is effective? Correct answer: ability to walk without pain. Kilostazol is prescribed for the treatment of intermittent claudication, a condition commonly associated with peripheral arterial disease, PAD. It works by inhibiting platelet aggregation and causing vasodilation, thereby improving blood flow to the extremities. The therapeutic response to kilostazol is demonstrated by the client's ability to walk longer distances without experiencing claudication pain, which indicates improved circulation to the legs. Question 31. A novice nurse is under the supervision of an experienced preceptor while caring for a pediatric patient diagnosed with epiglottitis. Which action performed by the novice nurse necessitates immediate correction? Correct answer: collecting a throat swab. Attempting to obtain a throat swab in a child suspected of having epiglottitis is dangerous and contraindicated due to the risk of inducing a sudden laryngospasm, potentially leading to a complete blockage of the airway. Epiglottitis is a critical condition characterized by severe inflammation and swelling of the epiglottis, which can rapidly compromise the airway. Any invasive procedure involving the throat should be deferred until the airway is secured, typically in a controlled environment, such as an operating room where an artificial airway can be established safely. Question 32. A nurse is providing pre-transfusion education to a patient who is about to receive a unit of packed red blood cells, PRBCs. What should the nurse emphasize during the teaching session? Correct answer: I will stay with you for the first 15 minutes of the transfusion. The initial 15 minutes of a blood transfusion are critical, as this is the period during which transfusion reactions are most likely to occur. The nurse must remain with the patient during this time to observe for signs of adverse reactions, which could include fever, chills, back pain, or more severe symptoms indicative of a hemolytic reaction. Prompt detection and response are essential to prevent serious complications, making continuous monitoring during these first few minutes a key aspect of transfusion safety. Question 33. A patient receiving depot medroxyprogesterone acetate for contraception makes a statement during a follow-up visit. Which statement indicates the need for further clarification? Correct answer: I need to come back for my next shot in 8 weeks. Depot medroxyprogesterone acetate, DMPA, is a long-acting contraceptive method administered every 13 weeks, not every 8 weeks. The patient's misunderstanding of the dosing schedule could lead to missed or mistimed doses, reducing the contraceptive's effectiveness and increasing the risk of unintended pregnancy. It is crucial for the nurse to clarify the correct interval between injections to ensure consistent and effective use of the medication. Question 34. A nurse is caring for elderly clients and needs to identify the most common cause of cognitive decline in this population. Which condition is the primary contributor to cognitive impairment in older adults? Correct answer: Alzheimer's disease. Alzheimer's disease is the leading cause of cognitive impairment in the elderly. This neurodegenerative disorder progressively destroys memory, thinking skills, and the ability to perform even the simplest tasks. Alzheimer's disease is marked by the buildup of amyloid plaques and neurofibrillary tangles in the brain, which disrupt communication between neurons and eventually lead to their death. As the disease advances, cognitive functions deteriorate significantly, making Alzheimer's the most prevalent cause of dementia in older adults. Question 35. A client with chronic gout is being treated by a nurse. Which medication is the nurse likely to anticipate being prescribed to reduce uric acid levels? Correct answer: allopurinol. Allopurinol is the standard medication prescribed to lower uric acid levels in clients with chronic gout. It inhibits xanthine oxidase, an enzyme responsible for the production of uric acid. By reducing uric acid levels, allopurinol helps to prevent the deposition of urate crystals in joints and tissues, thereby decreasing the frequency and severity of gout attacks. It is a long-term management strategy for gout and is essential for preventing complications such as kidney stones and joint damage. Question 36. A nurse is preparing to change the dressing of a patient with extensive burn injuries, including deep partial thickness and full thickness burns. Which of the following actions would be considered inappropriate before starting the dressing change? Correct answer: administering an oral pain reliever, like a COX-2 inhibitor half an hour prior. Administering an oral COX-2 inhibitor, a type of non-opioid pain reliever, before a dressing change for severe burns is inadequate for managing the intense pain associated with such a procedure. Opioids administered intravenously are the preferred method of pain control in this situation due to their rapid onset and effectiveness in relieving severe pain. Burn wound care is typically associated with significant discomfort, and optimal pain management is crucial to minimize the patient's suffering during the dressing change. Question 37. A pregnant client at 34 weeks gestation presents with intense itching on her palms and soles, dark-colored urine, and yellowing of the sclera. Laboratory tests reveal elevated bile acids and alanine aminotransferase, ALT. What diagnosis is most likely? Correct answer: intrahepatic cholestasis of pregnancy. Intrahepatic cholestasis of pregnancy, ICP, is a liver disorder that occurs during pregnancy and is characterized by pruritus, itching, particularly on the palms and soles, dark urine, pale stools, and jaundice. The condition is diagnosed based on symptoms and elevated levels of serum bile acids and liver enzymes such as ALT. ICP poses significant risks to the fetus, including preterm birth, fetal distress, and stillbirth, making early detection and management essential. Question 38. During routine hygiene care, the nurse observes that the patient's fingertips are noticeably enlarged with an increased amount of soft tissue under the nails. What condition does this observation most likely indicate? Correct answer: chronic hypoxia. The patient's description suggests digital clubbing, a sign typically associated with chronic hypoxia. Clubbing is characterized by the enlargement of the fingertips and a curving of the nails around the tips of the fingers. It is commonly seen in individuals with chronic lung diseases, such as chronic obstructive pulmonary disease, COPD, or congenital heart defects, which lead to prolonged oxygen deprivation. Question 39. When conducting an abdominal examination, the nurse should. Correct answer: listen for bowel sounds following a visual inspection of the abdomen. The correct sequence for an abdominal assessment involves inspecting the abdomen, auscultating for bowel sounds, percussion and palpation. This order is important because palpation and percussion can alter bowel sounds, potentially leading to incorrect assessment findings if performed before auscultation. Question 40. A client presents to the emergency department with slurred speech, unsteady gait, and nystagmus. Which condition is the nurse most concerned about? Correct answer: alcohol intoxication. The clinical presentation of slurred speech, unsteady gait, and nystagmus strongly suggests alcohol intoxication. Alcohol intoxication occurs when a person consumes a significant amount of alcohol, leading to central nervous system depression. Symptoms include impaired coordination, slurred speech, and altered mental status. Question 41. A patient diagnosed with Alzheimer's disease has just finished their meal in the communal dining area. Shortly after, they ask the nurse, "When will I be served breakfast? I haven't eaten anything yet today." Which response from the nurse would best address the patient's concern? Correct answer: would you like something to eat? I can bring you some bread. Patients with Alzheimer's often struggle with short-term memory, leading them to forget recent activities like eating a meal. The nurse's role is to minimize distress by providing comfort without arguing or increasing confusion. Offering food acknowledges the patient's current reality and reassures them, aligning with person-centered care principles. Question 42. A healthcare provider orders 500 milligrams of metronidazole to be given intravenously over 30 minutes. The pharmacy provides the medication in 100 milliliters of saline solution, labeled with 500 milligrams of metronidazole. The question asks, at what rate should the nurse set the IV infusion pump to deliver this medication? Correct answer: 200 milliliters per hour. Let's break it down step by step. To determine the infusion rate, use the formula. Rate in milliliters per hour equals volume in milliliters divided by time in hours. Now, plugging in the values. Rate equals 100 milliliters divided by 0.5 hours. That equals 200 milliliters per hour. So, the nurse should set the IV pump to 200 milliliters per hour to ensure the correct delivery of the medication. Question 43. A patient presents with difficulty breathing, crackling sounds in both lungs, weak pulses, and pink, frothy sputum. Which of the following prescribed interventions should the nurse reconsider? Correct answer: administering diltiazem. The patient's symptoms suggest acute left-sided heart failure with pulmonary edema. Diltiazem, a calcium channel blocker, can reduce myocardial contractility, worsening heart failure. The nurse should question this order to prevent further deterioration. Question 44. In the emergency room, a patient is triaged after experiencing sudden onset of anxiety, nausea, chest tightness, and a sense of impending doom. What is the priority nursing action? Correct answer: perform a 12-lead ECG. These symptoms mimic both a panic attack and a myocardial infarction. The priority is to rule out a life-threatening cardiac event by obtaining an ECG before addressing anxiety-related causes. Question 45. The nurse is educating a client about advanced directives as part of their care plan discussion. This information primarily supports which of the following client rights? Correct answer: autonomy. Advanced directives allow clients to express their healthcare preferences in case they become unable to communicate. This supports autonomy, ensuring their medical decisions are respected. Question 46. During an assessment, a client is suspected of having acute cholecystitis. Which clinical finding would most strongly indicate this diagnosis? Correct answer: elevated white blood cell count WBC. Acute cholecystitis causes inflammation of the gallbladder, triggering an immune response that leads to an elevated WBC count. Question 47. A nurse reviews a client's lab results and notices a potassium level of 5.6 milliequivalents per litre. The normal range is 3.5 to 5.0 milliequivalents per litre. What ECG change would the nurse most likely expect? Correct answer: tall peaked T waves. Hyperkalemia affects cardiac repolarization, causing tall peaked T waves. If untreated, it can lead to life-threatening arrhythmias. Question 48. A nurse is assigned to administer an intravenous infusion of heparin at 15 units per kilogram per hour for a client weighing 70 kilograms. The available heparin concentration is 25,000 units in 250 milliliters of D5W. The question asks, how many milliliters per hour should the nurse set the IV pump to administer? Let's calculate step by step. Determine the total heparin dose per hour. Multiply 15 units per kilogram per hour by 70 kilograms. 15 times 70 equals 1,050 units per hour. Calculate the infusion rate. The available concentration is 25,000 units in 250 milliliters. That means 100 units per milliliter. Now, divide 1,050 units per hour by 100 units per milliliter. 1,050 divided by 100 equals 10.5 milliliters per hour. Round to the nearest whole number. 10.5 rounds, up to 11 milliliters per hour. Final answer: 11 milliliters per hour. A client scheduled for a hip replacement expresses significant anxiety about the upcoming surgery. What is the most therapeutic response by the nurse? Correct answer: C. Can you share what you've been told about the surgery? Rationale: encouraging the client to express their understanding and concerns allows the nurse to address misconceptions and fears, promoting open communication. Question 49. A family member of a patient lodges a complaint with the nurse manager about night shift care. What should be the first course of action? Correct answer: investigate the complaint by talking directly to the family member and the patient. The nurse manager should gather information firsthand from the family and patient before addressing the night shift nurse. This ensures fairness and a comprehensive understanding of the situation before taking any corrective action. A client in her 38th week of pregnancy is scheduled for a fetal well-being assessment. She is curious about the reason for this test. How should the nurse respond to the client's inquiry? Correct answer. This test evaluates your baby's health and condition during the final weeks of pregnancy. A fetal well-being assessment, often performed as a non-stress test, NST, is a common test in the third trimester to evaluate the fetus's health, including heart rate, oxygen supply, and overall condition. An adolescent diagnosed with cystic fibrosis is experiencing frustration due to frequent school absences and is withdrawing from social interactions. Which nursing intervention would best address this client's current concerns? Correct answer. Facilitate a virtual meeting between the client and another adolescent living with cystic fibrosis. Facilitating a virtual connection with another adolescent who shares the same condition can provide essential peer support, helping the client cope with emotional and social challenges related to cystic fibrosis. During a staff development workshop on domestic violence, a nurse presents several misconceptions. Which participant's comment shows an accurate understanding of the topic? Correct answer. Men might not report abuse due to societal views on masculinity. Men often face significant societal stigma when it comes to reporting intimate partner violence, IPV, making them less likely to seek help. A patient experiencing a sudden exacerbation of gout is admitted to the hospital. Upon reviewing the medication list, the nurse identifies a potential culprit for the flare-up. Which medication might have contributed to this gout flare? Correct answer. A common diuretic prescribed for hypertension. Thiazide diuretics, such as hydrochlorothiazide, are known to increase uric acid levels in the blood, which can precipitate gout attacks. A nurse is evaluating several infants to identify the one with the highest risk for sudden infant death syndrome, SIDS. Which infant is most at risk? Correct answer. A preterm male, 3 months old, who sleeps on his side and is breastfed. The preterm 3-month-old male who sleeps on his side is at the greatest risk for SIDS, as side sleeping is unsafe and preterm infants have a higher vulnerability. A pediatric nurse is preparing to care for an infant diagnosed with developmental dysplasia of the hip, DDH. Which intervention is most likely to be prescribed by the healthcare provider? Correct answer. A harness that keeps the infant's hips in a stable, abducted position. The Pavlik harness is the treatment of choice for infants diagnosed with developmental dysplasia of the hip, DDH, keeping the hips in an optimal position for proper development. During an abdominal examination of a client with suspected gastroenteritis, a nursing student is being observed by their instructor. Which sequence of actions demonstrates the correct assessment technique? Correct answer. Looking, listening, tapping, feeling. The proper sequence for an abdominal assessment is inspection, looking, auscultation, listening, percussion, tapping, and palpation, feeling. Performing percussion or palpation before auscultation can lead to altered bowel sounds, making assessment inaccurate. A nurse in the emergency department is prioritizing care for incoming patients. Which patient should be classified as needing immediate, life-saving intervention? Correct answer. A patient with sudden loss of coordination and slurred speech. The patient experiencing sudden onset of ataxia, loss of coordination, and dysarthria, slurred speech, is likely having a stroke or another neurological emergency requiring immediate intervention. A client is brought to the emergency department after nearly drowning in a local lake. Which clinical findings should the nurse anticipate upon assessment? Correct answer. Low oxygen levels, high carbon dioxide levels, and an acidic blood pH. In cases of non-fatal drowning, the client is likely to present with hypoxia, low oxygen levels, hypercarbia, elevated carbon dioxide levels, and acidosis, a build-up of acid in the blood, requiring urgent medical intervention. A client who missed their scheduled healthcare appointment explains, "I missed it because I was too tired, but I figured it wouldn't have helped much anyway." Which psychological defense mechanism is the client displaying? Correct answer, rationalization. Rationalization is a defense mechanism where an individual justifies or explains their behavior in a way that seems logical or acceptable, rather than acknowledging the true underlying reason. A nurse is instructed to administer 0.375 milligrams of digoxin intravenously. The available digoxin vial is labelled as 0.25 milligrams per milliliter. How many milliliters should the nurse administer? The correct answer is 1.5 milliliters. To determine the correct volume, we use the formula. Dose ordered divided by dose available equals volume to administer divided by volume available. Substituting the values. 0.375 milligrams divided by 0.25 milligrams per milliliter equals X milliliters. Solving for X. X equals 1.5 milliliters. Thus, the nurse should administer 1.5 milliliters to deliver the ordered dose of 0.375 milligrams of digoxin. A client receiving treatment with tolvaptan is being evaluated for therapeutic effectiveness. Which clinical finding would suggest that the medication is working as intended? Correct answer, a urine-specific gravity of 1.010. A urine-specific gravity of 1.010 indicates effective treatment, as it shows that the urine concentration has normalized. Tolvaptan is used for the management of CIADH, and an improvement in urine dilution suggests that the drug is correcting the underlying hyponatremia. The nurse is monitoring a patient who has been prescribed enoxaparin for deep vein thrombosis (DVT) prophylaxis. Which clinical manifestation would most likely suggest that the patient is developing a serious adverse reaction to the medication? Correct answer, a sudden drop in platelet count. A significant decrease in platelet count, known as thrombocytopenia, may indicate heparin-induced thrombocytopenia, CHI-T, a serious and potentially life-threatening adverse reaction to enoxaparin. Early identification and intervention are crucial. The nurse is documenting the total fluid intake for a patient who has received both oral fluids and intravenous fluids over the last 6 hours. How many milliliters or milliliters of fluid has the patient ingested and received intravenously? The correct answer is 1,950 milliliters. Let's break it down. The patient has been receiving normal saline at 0.9%, infused at 125 milliliters per hour for 6 hours. This equals 750 milliliters from the IV fluids. Now, let's calculate the oral fluids. 3 8-ounce cups of cranberry juice. Each cup contains 240 milliliters, so the total is 720 milliliters. 1 8-ounce cup of coffee. This equals 240 milliliters. 1 8-ounce cup of water. Again, 240 milliliters. Now, let's add them up. Intravenous fluids, 750 milliliters. Cranberry juice, 720 milliliters. Coffee, 240 milliliters. Water, 240 milliliters. Total fluid intake, 1,950 milliliters. A nurse is supervising a newly licensed nurse who is managing a patient experiencing status epilepticus. Which action performed by the newly licensed nurse would require the supervising nurse to intervene immediately? Correct answer, preparing intravenous lorazepam. The most critical intervention in status epilepticus is the immediate administration of IV lorazepam or another benzodiazepine to terminate the seizure. Delay in administration could lead to prolonged seizures and increased risk of complications. A nurse is evaluating a patient with unexplained bruising on the torso and upper limbs. Which laboratory result is most likely to explain this finding? Correct answer, platelet count, 70,000 per cubic millimeter. Now, let's break this down. A low platelet count, also known as thrombocytopenia, increases the risk of bruising and bleeding. Normally, the platelet count should be above 150,000 per cubic millimetre. In this case, the count is 70,000 per cubic millimetre, which is significantly low. This explains why the patient is experiencing unexplained bruising. Key takeaway: low platelets equals higher risk of bruising and bleeding. 67. A nurse discovers that a patient's chest tube has become dislodged from the chest drainage system. What is the nurse's immediate priority action in this situation? Correct answer. Apply a sterile occlusive dressing to the insertion site and secure it on 3 sides. Applying a 3-sided occlusive dressing prevents air from re-entering the pleural space, reducing the risk of tension pneumothorax while allowing air to escape. This immediate intervention stabilizes the patient before further medical intervention. The nurse educates a patient on the benefits of consuming cranberry juice to help prevent urinary tract infections, UTIs. What is the main mechanism by which cranberry juice is thought to prevent recurrent UTIs? Correct answer. It increases the acidity of the urine. Cranberry juice lowers the urine pH, creating an environment that is less favourable for bacterial growth, particularly E. coli, which is the most common cause of UTIs. Question 69. A nurse reviews a patient's laboratory results and notes that the serum digoxin level is 2.5 nanograms per milliliter. What should be the nurse's immediate response to this finding? Correct answer. Alert the primary healthcare provider about potential digoxin toxicity. A digoxin level above 2.0 nanograms per milliliter suggests digoxin toxicity, which can cause life-threatening arrhythmias. Immediate intervention is required to prevent complications. Question 70. A nurse is tasked with administering a bolus of regular insulin to a patient diagnosed with hyperglycemic hyperosmolar state, or HHS. The patient weighs 277 pounds and the prescription is for 0.1 units per kilogram. How many units of insulin should the nurse administer? Correct answer. 13 units. First, convert weight to kilograms. 277 divided by 2.2 equals 125.9 kilograms. Now, calculate insulin dosage. 125.9 times 0.1 equals 12.59, rounded to 13 units. Question 71. A patient receiving amphotericin B therapy is undergoing routine laboratory monitoring. Which laboratory value is most critical for the nurse to assess during this treatment? Correct answer. Serum potassium level. Amphotericin B is known to cause nephrotoxicity and hypokalemia. Monitoring serum potassium is essential to prevent dangerous electrolyte imbalances that can lead to cardiac arrhythmias. Question 72. A nurse is preparing educational material for a staff development session on managing diabetic ketoacidosis, or DKA. What key point should be emphasized in the management of DKA? Correct answer. The aim is to reduce blood glucose by 50 to 75 milligrams per deciliter per hour. In treating diabetic ketoacidosis, it is essential to lower blood glucose levels gradually by 50 to 75 milligrams per deciliter per hour to prevent complications such as cerebral edema. A rapid drop in glucose can cause drastic shifts in fluid balance and osmolality, leading to serious consequences. Question 73. A nurse is administering a medication with a narrow therapeutic index, or NTI, to a patient. What is the nurse's primary responsibility when administering this type of medication? Correct answer. Administer the medication exactly as prescribed, adhering strictly to the dosing schedule. Medications with a narrow therapeutic index require precise dosing because small deviations can lead to either toxicity or subtherapeutic effects. Examples of NTI drugs include warfarin, digoxin, and lithium. These drugs require close monitoring of drug levels, renal function, and patient response to prevent complications. Question 74.
A patient with end-stage renal disease, or ESRD, returns from their first session of hemodialysis. The nurse performs an assessment and notes several findings. Which finding requires the nurse's immediate attention and intervention?
Correct answer. Complaints of a severe headache and feeling nauseous.
Severe headache and nausea following hemodialysis may indicate dialysis disequilibrium syndrome, or DDS. This is a potentially life-threatening condition caused by rapid shifts in fluid and electrolytes, leading to cerebral edema. Immediate intervention is required, such as slowing the dialysis process and closely monitoring neurological status to prevent progression to seizures or coma.